student nurse Rebecca today, and I'm going to be doing a newborn assessment on your brand new baby.
I'm Matt, nice to meet you.
Nice to meet you. I'm going to be checking her wristbands. Can you verify her name and date of birth?
Her name is Anastasia Shoemaker. She was
Okay.
born October 29th, 2020.
Okay, and it's October 30th right now.
Yes.
Okay, so she's about 6 hours old. I checked her chart, and I'm going to be doing hand hygiene. And last time she was weighed at 9 pounds 2 ounces. And I'm going to be doing her vitals and checking all of her systems to make sure that everything is normal, okay?
Okay.
Okay. Alright, so I'm going to start inspecting her head, and we'll do the vitals as we go down. So I'm going to start at her head. I notice that it's round and symmetrical, and I can feel her anterior fontanelle, that's a diamond shaped, and her posterior fontanelle, that is a triangle shape. I don't feel any caput saccudium or any edema or any trauma. I don't see any bruising on the face or any trauma from her vaginal delivery. Her ears are at the same height as her eyes, and they are symmetrical. She has 2 ears and 2 eyes. I'm going to pull down the pinna to see if it pops back into place, and it does. And I'm going to be inspecting her eyes. Okay, she has blue eyes, and she has a white sclera, and she already has eyelashes. And I'm going to see if her pupils are reactive. Okay.
Are they supposed to be?
Yes. Yours are also reactive, I'm sure, if I assess them. So they went from a size 3 to a size 2, which is normal. Okay? And let's see, her nose is symmetrical. I don't see any milia on the nose or around the face. If I occlude her right nostril, she's still breathing out of her left. If I occlude her left nostril, she's still breathing out of her right. If we were able to take the pacifier out, we would notice that she has a normal palate, no cleft palate, no thrush, everything is normal. Don't see any teeth or anything like that. Having the pacifier in is an okay thing, because pacifiers, according to the literature, are actually can help in preventing SIDS. And I also want to check to make sure that her sleeping space is appropriate and there's nothing close to her. She's in that bassinet here, so there's nothing close to her. She's laying on her back, which is good for safe sleep. And now I'm going to be assessing her neck. I see that she has symmetrical neck folds, and she doesn't have any neck folds on her back, on the back of her neck, which is normal. I'm feeling for any lymph nodes that are palpable. I don't feel any lymph nodes that are palpable. Now we're going to move, actually before we move down, I'm going to measure her, head. Now this is what we're working with here at Hospital Shoemaker. So I'm going to be measuring.
You should have went to Christ.
Her head circumference. And okay, I have her head circumference at 14, and now I'm going to be assessing her chest, and we can start doing some of her vital signs. I'm going to count her apical pulse for an entire minute. I'm going to be going in the 4th intercostal space, the left 4th intercostal space. Okay, I counted for an entire minute. It was 131 beats per minute. That's normal. And since we're here, I'll listen to her lungs and count her respirations as well. I noticed that her abdomen is also rising and falling with her breathing. That's normal for a neonate. And she doesn't have any nasal flaring or retractions. She's not in any respiratory distress right now, which is good. I heard her lung sounds and they were clear in all lobes. I'm also going to count her respirations. For a full minute. Okay, so her respirations were at 39. That's also normal. So I'm also going to inspect the chest. I'm also looking at her shoulders and her arms and her extremities. I don't see any lanugo, which is good. Her arms can abduct and internally rotate, and they can be flexed. And I can see where her umbilical cord was clamped, and she has her gauze on right here, and it's still clamped, and there's no bleeding. If I touch it, I can feel a pulse here. I'll give that a rating of 2+. I'm going to feel for her apical. I can also feel for a rating of 2+ on her apical. Let's do her radial. You can just go down to do her femoral. And her pedal. So I got a rating of 2+ on all of those pulses, so that's good. And I'm making sure I actually can feel her xiphoid process, which is not abnormal for a neonate. And now we're going to assess her abdomen. I'm going to listen to all 4 quadrants. I know that she had already passed her first stool of meconium, right?
Yes.
Yes, right. Do you remember what it looked like?
It was green.
Was it green? Normally meconium is black and tarry.
Oh yes, it was black and tarry.
But you said it was green. There was a little bit of green.
There was a little bit of green.
Okay. I'll add that to the documentation. All right, I'm going to listen to her bowel sounds. I'm going to start in the right lower quadrant. Okay, I heard active sounds. I don't want to palpate too much on her abdomen because she does have her umbilical cord still there, but everything looks normal. We can look at her skin color. Her skin is pink. I don't see any abnormalities anywhere. I don't see any more vernix carosa in any of her skin folds or anything like that. That's what comes out with the baby, that covers the infant when the infant comes out of the canal. And now we can move down to the genitals. She is a female that I can see. Her labia majora is over her labia minora, which is normal. I don't see any pseudomenstruation. Have you seen any pseudomenstruation in her diaper?
Is that blood?
Yeah, a little bit of blood.
No.
No? Okay. And so now I'm going to be checking her, I'm looking at her legs. Everything's symmetrical, the same length. Her hips abduct to at least 60 degrees. They're symmetrical. If I look, her skin folds are the same. And I'm going to be looking at her feet and her hands. We're going to count all the fingers. 5 on that hand, 5 on that hand. No syndactyly or polydactyly, no webbing. Looking at the toes, 5 on this foot, 5 on that foot. Also no webbing, very normal. Okay, and now I'm going to lay her prone and her head to the side so she can still breathe. I'm checking her spine. It looks straight down her back. I don't see any curvatures. I can listen to her lungs real quick. Make sure that they still sound good. From the back. Still sound good from the back. Her gluteal folds are symmetrical, and I don't see any Mongolian spots or any other abnormalities to the skin. Can turn her back over, and now I'm also going to be doing her temperature.